My innovation involved preventing central line infections in the NICU by having a central line that was infused with antibiotics. So developing my idea. Central line infections in the NICU are a very serious condition because the central line goes into a main artery or vein. If they would get any kind of infection around their line, they get sepsis very quickly, and sepsis in neonates can cause death, and it's also very costly to treat. So brainstorming of a solution for preventing central line infections, I had a few ideas. One of my first ideas involved using a CHG impregnated dressing. CHG is a special chemical that kills bacteria, even antibiotic-resistant bacteria and almost those superbugs. CHG can also kill. They come in a clear dressing too that would be perfect for over a central line because you could still assess the site. However, more research into that showed the CHG could burn infant skin. Also, I thought about having antibiotics added to TPN, which is the IV nutrition given to infants through their central lines. However, this would increase the expense of TPN, and also TPN is mixed in 250 ml bags. The bags hang for 24 hours, but not all 250 ml is given. So while we are able to regulate electrolytes and chemical makeups of the solution, you wouldn't be able to guarantee that the dose of antibiotic would be infused during the time period. Another idea involved impregnating a central line with antibiotics. So while researching, I found out that catheter-related infections are one of the most severe complications of central line placement, and the rate of infection can be anywhere from 16.4% to 28.8%. If treatment is not timely or correct, the rate of infection and mortality can skyrocket. Current techniques to prevent central line infections include sterile line dressing changes, alcohol caps to cover all the hub ports on lines, and line changing bundles, which is a policy or procedure used when hanging new fluids, hanging new tubing, that almost makes it a sterile process. So we posted about all our innovations on Blackboard and got feedback from the rest of the class. After posting my ideas on Blackboard, the feedback I got from other students, they felt like the idea to best implement would be the antibiotic impregnated central line. The feedback I received was positive with the antibiotic impregnated central line because many people thought it was a more proactive approach instead of a reactive approach. We treat the central line infection with antibiotic, so why not have a line that's infused with antibiotic to prevent the line from getting infected in the first place? My elevator pitch. Be proactive, not reactive. Don't wait till a problem starts to fix it. Prevent it altogether with antibiotic-impregnated central lines. These lines can prevent newborn infants from getting life-threatening central line infections. By having a line infused with antibiotics, you're using a product that is being proactive in fighting and preventing these infections. By preventing these infections, the hospitals are not only saving money spent to treat these infections, they can save the lives of our youngest patients. How my innovation fits in within the framework of innovation. One of the pillars of the framework of innovation is cost. The cost of treating a central line infection can be anywhere from $34,000 to $56,000, with an average cost being about $45,000. And this was found in an article by Curry et al. In 2009. When investing to create, test, and implement the line, it'll be very costly to create and implement, but many hospitals are going to purchase them because they're going to end up saving money on the catheter-associated bloodstream infections, which are so costly to treat. Another pillar of innovation is quality. Central line infections not only make infants critically ill, they can cause death. And you're not providing quality care to the patient if something you place in the patient to help them get better can cause them to get ill and possibly die. Also, a quality indicator that's used to measure hospitals has to do with the reduction of hospital-acquired infection. Any central line infection is considered a hospital-acquired infection because it was something that they contracted while in the hospital and while the hospital was doing things to treat them and help them get better. So all hospitals want to improve these indicators to get better rankings. Another framework of innovation pillar is efficiency. Preventing these line infections before they occur is one of the most efficient things you can do. And also, by being proactive instead of reactive, by having an approach of a line that's already infused with an antibiotic, you're helping to be more efficient. The last pillar of framework of innovation is outcomes. The outcomes that can happen if you prevent central line infections include a decreased length of stay in the hospital and decreased infant mortality. Transforming my idea from innovation to reality. First, someone would have to develop the antibiotic-impregnated central line. Then, obtaining a trial or testing period would be the most difficult. One barrier would be that we would need authorization from the IRB, or the Institutional Review Board. Because infants are considered a high-risk population, they require approval. Not all populations do. Also, part of this approval would be containing a highly specific informed consent prior to the trial, because parents would have to consent to their infant using these antibiotic-impregnated lines before any testing began. Then it might also be difficult to find a facility to complete the testing in, or the trial in. Many facilities will only use products that have evidence-based research supporting it. While there is research supporting that central line infections are not good, there's not necessarily research supporting this specific product in preventing them. But hopefully those barriers could be overcome and this product could become a reality. And here is just some references that I used to complete this project on innovation.